Hi, everybody. I'm Quinton Lucas, Mayor of Kansas City. I'm joined today by Dr. Rex Archer, our Director of Public Health, and Dr. Erica Carney, our Emergency Medical Director. We have a few things to announce for you in connection with Kansas City's response to COVID-19. As we've seen in a number of other jurisdictions, there continues to be significant concern with the spread of COVID-19, continuing taxation on certain public health and medical resources, and that's why we are taking the ongoing steps we will today. First of all, we are extending our mask order in Kansas City, Missouri indefinitely to run along with our state of emergency order. At present, our state of emergency relating to COVID-19 runs until August 15th. If that order expires on August 15th, then of course that will be the end of our mask order. If it does not, then the mask order will stay for some amount of time. We also know that there have been a number of outbreaks relating to bars and other kind of facilities of that sort. So we're maintaining our 50% capacity limit on all bars and taverns in Kansas City. We encourage bar patrons and others to maintain social distancing, to maintain that important spacing, and more than anything, to the fullest extent possible, to wear masks. That will be essential for us. As a reminder, masks and face coverings are required when you're indoors and cannot maintain 6 feet of social distancing space. That's the rule and that's your limit. However, we certainly encourage you to wear masks in more situations, as we know that the virus is spreading fairly broadly. Wearing a mask outdoors when in close proximity, doing any number of those protective items can help keep you, your friends, and your family safe from COVID-19. There are others who ask about exceptions to the rule, and generally we do want to establish that most everyone should be wearing masks. However, we know that there are some that have asthma, other respiratory conditions, or suffer from illnesses and conditions that do not allow them to wear a mask and to breathe properly. We do say that if there's some medical threat to you in wearing a mask, that you needn't do so. A few other technical details about what we're working on in our COVID-19 response in Kansas City, and then I'll turn it over to our medical professionals, and then I'll come back for questions. As you know, we passed a small business relief fund in Kansas City, Missouri some weeks ago, $500,000 worth of funds to support small businesses. All of that money has now been distributed to businesses in Kansas City. A total of 128 applications were received and 28 loans were awarded. We've been asked by many for transparency purposes as to whom will receive these loans or who has. We will be sure to share that business information with you, and that will come from the Kansas City Mayor's office. In addition to our citywide small business relief, because at this point we have received funds only from Clay County, Missouri, we have been able to establish a $1.5 million business relief fund for businesses in the Clay County portion of Kansas City, Missouri. Our applications are now live at EDCKC, that's the Economic Development Corporation of Kansas City, edckc.com. Businesses in the Clay County portion of Kansas City, so in northwest Kansas City, can apply for grants of up to $50,000 online. We will look to use those grants in their entirety until such point as all that money is expended, and then we'll look to do even more small business grants for those in Clay County. We understand that in the Jackson County legislature, they have passed at least an initial step of our ability to receive, I believe, up to about $16 or $17 million of CARES Act funding. Once we're able to receive that funding from Jackson County, we'll be excited to expand our programs, but we're excited today to announce having at least $1.5 million for businesses in Clay County. We would also note that we have a $1 million fund to help support certain emergency rental, utility, and nutrition services in the Clay County portion of Kansas City as well. If you're interested in receiving that sort of support, call Northland Neighborhoods at 816-454-2000. That's 454-2000. And another important part of our response to COVID-19 is certainly relating to testing. For those of you who work in the bar and restaurant industry, the health department, I think, has done an outstanding service, which is that if you're a Missouri resident, not a Kansas City resident alone, but a resident of Missouri, you can sign up for COVID-19 testing if you're in those certain industries. For that, you can call 311 for those services. The city will also be offering for all Kansas Cityans a large COVID testing event at the Home Field Sports Facility. That's at 5000 Bannister Road. And testing will be available from 7 a.m. to 7 p.m. Monday, Tuesday, and Wednesday. Pre-registration, however, is required. You can register online, kcmo.gov, or by calling 877-435-8411, or as I always do, call our trusty 311 service, and they can get you that information. We will continue to have more large-scale testing events as we deal with COVID-19. I think what you're seeing today, and I know the medical professionals will join me in this, we will learn to coexist with COVID for the time being. It will be important for us to continue to wear masks. It will be important for us to maintain social distancing, and lots of it, and we've talked about this a few times before. It will be important for us to self-police. What that means is for our business owners, for our private party goers, for so many others, it's important for you to make sure people are wearing masks. It's important for you to make sure that if you're having a family event, that you're mindful of the fact that so many of our COVID-19 outbreaks, including deadly ones, have started at family events. And we want to remind you of that situation in Springfield, Missouri, where the hairdresser had worn a mask, and even though she had seen, I think, in excess of 100 patrons, right, there was not an infection because she had followed the rules set by her public health department. So I'll turn it over to Dr. Rex Archer now with further comments.
Thank you, Mayor. Where the science is, where our experience is with other countries and other parts of this country is, the number one thing we can do to be slowing down and bringing this outbreak under control is wearing the mask. If we can get 95% or better of our residents doing that on a regular basis, then we can bring it under enough control that then disease outbreak investigation, contact tracing can put out the small fires. Self-policing to the degree that it's done politely is fine, but you don't know for sure whether somebody else has some type of a medical condition that prohibits them from wearing a mask, or a communication issue or challenge. So if you have a group where some people are hearing impaired and need to be able to read lips, you can't be wearing a mask in that setting. But that's less than 5% of our population for those types of things. So we can still get this under control, but let's be polite and civil as we politely ask people, where's your mask? And don't get into arguments with folks. That's not helpful in this outbreak. If we do this, the chances that we can safely reopen schools goes way up. If we can keep the prevalence of the disease down in our community, our grade school kids in particular need that classroom experience. So let's help our kids by doing this. And for those that love sports, the chances that we'll be able to get fans back into the stadiums, probably at much smaller numbers in the beginning, are much higher if we do this. So please help us help our city by wearing masks. Thank you. Dr. Carney?
Thank you, Mayor. Thank you, Dr. Archer. I'm here to talk to you guys about our hospitals and our pre-hospital. So we have found that over the past few weeks on the pre-hospital and the hospital side, our patient volumes have pretty much increased back to pre-corona numbers. This does mean that most of our hospitals, especially our level 1 trauma centers, have been full and at capacity. For our people who are working in the hospitals, we continue to have a few employees who are furloughed. We do have a few employees who have been positive as well. That adds to the stress of being at full capacity. Whenever we have traced where these positives have come from, what we found is that has been usually community outbreaks and not job related. So what that tells me is that the masks do work. When we are seeing corona patients in the hospitals and we are fully masked, we are staying negative. And so for all of the hospitals that are listening, the pre-hospital agencies, continue to meet just as you are, continue to go through your surge planning, and please reach out if you guys have any questions.
All right. Any questions for you?
Yeah, Mayor, number one, is there any consideration underway, or what would be the conditions that you would consider closing the bars and taverns down and perhaps even restaurants?
I think we'll continue to consult with our medical and our professional advice in connection with needing to close down bars and restaurants. I think Dr. Archer was very clear for us, which is that if we wear masks, if we continue to follow safeguards, we're fairly confident that we may not need to get to that point. However, I think if we see spikes, particularly if we can trace them back to bars, other establishments of that sort, and we continue to see that level of spread, the community spread happening at those types of establishments, then that is absolutely something we'll evaluate. I will say this, and I've said it before, it is my preference for us to not have to shut down parts of the economy again at any point. However, should it become necessary, we'll do all that is necessary, as you've seen in Texas, as you've seen in Arizona, not big progressive states, but in places where they've seen that the spread was so significant that they needed to take that step to keep people safe.
Mayor, you say if you see a spike, there are, the second day running, hundreds of cases being reported in the metro area.
Yes.
You know, doesn't know borders. Isn't this a spike now?
I think it's fair to say we are in a spike now, and we've had conversations about ways that we are trying to address it. The mask order is still relatively new. We think that this will be an important step in making sure that we have a strong public health response. But we will continue to measure spikes and increases. Dr. Archer is in consistent communication with other medical directors in this region, our state health director in Missouri, and so I think we will take every option necessary to make sure people stay safe, up to and including further closure orders or something else that Dr. Archer referenced, looking at start dates for our schools, those sorts of things to try to keep people safe.
One more here. You're speaking about the mask in a conditional fashion, that if people wear masks,
Yes.
if more people wear masks, the implication behind that is that a mask requirement is not functioning as you hope, and that the control efforts are not functioning as you hope as well. Is that fair? Is that accurate?
I don't think that's accurate. I'm actually, I've appreciated the people of Kansas City who, in a course of very few months, have changed everyday activity. I think that we do see, and when you go to most establishments in Kansas City, people are wearing masks. A lot of our large retailers have signs out at the front talking about masks. They're asking people to wear masks when they come in. I think you are seeing large-scale compliance. There is not perfect compliance, and I understand that. And I've probably seen a story on each of your stations where you found people who weren't wearing it, but I think when you look at the fact that before, 0% of Kansas Cityans were wearing masks every day, and now I would like to say that in most of my travels, in excess of probably 85% or 90% are wearing masks when they're going to establishments. We've seen outstanding progress, and I think, frankly, it will only get stronger as time goes on. Reminds me of another point that I do want to make, which is how important it is for young adults or even not so young adults to wear masks as well. For folks in their 20s and 30s, we are seeing infections, particularly folks in their 30s and 40s, and so it is important for folks, even if you think you'll be fine, to wear a mask as well. John?
Mr. Mayor, how are these rules impacting the city's violence prevention events that target young people? I'm talking about
Sure.
Club KC and Hot Summer Nights, gatherings.
Yeah, it is an unfortunate reality that programs that we've known in Kansas City for years, Hot Summer Nights, Mayor's Night Hoops, Club KC, and other events that aren't run by the city have been suspended in some ways, the Police Athletic League, etc. We continue to try to find approaches to how we can engage with our young people, how we can keep them in a safe environment. There's frankly nothing more important than being able to do that, and that is something both at local government and a number of community organizations are working on. We've tried to, I think, alter what that looks like for us, up to and including video game tournaments. Not something I know a lot about, but I think young people like those sorts of things, and so trying to do more of that interactive work.
In the urban core, do you believe that violence is more of a threat to public health than the virus right now?
John, that's like asking, would you rather die of cancer or die of a gunshot wound? I mean, I think both are incredibly threatening, and I would not wish to die of either. So, no, there's not an either or. They're both awful things that we're trying to prevent in Kansas City. Yes, ma'am.
Mayor Lucas, I was just wondering, when it comes to the mask mandate, and you have these businesses, especially some of these people that are just young, these are kids right out of high school, and they're trying to incorporate saying, hey, you need to wear a mask. For those people that are very reluctant to wear one, is there a big message you have for businesses, or the people that are going in saying, hey, I'm reluctant to wear one and I want to cop an attitude, but
Yeah.
I mean, what message do you have? For
Yeah, my predecessor's chief of staff is a gentleman by the name of John McGurk, who I think put it very well once. And he said, yeah, it's really simple, right? Let's say you're going to a convenience store. Most of us drive in this city, but let's say you go in, you put on your mask when you get out the car, you go in, you buy your thing, right? Then you leave, you go back to the car, you take your mask off. It is an incredibly minor type of impediment on your daily life. And so what I would say to people is just be respectful and thoughtful of someone else. Over the years, we've learned of a number of different campaigns. Be Kind, Rewind, right, for a classic. And I think this one could just very simply be, right, just wear a mask and we get back to having normal schools. Wear a mask and we get back to knowing life the way we have it. And if you wear a mask, we avoid further shutdowns, the very types of which you're seeing in other parts of America, particularly the Southwest, and I hope not in the future here in the Midwest. So that's what I would say to folks. The other thing that I would say is, it's such a fascinating time in America where everything seems to be political, but masks really don't need to be. The reason I keep mentioning Arizona, Texas, Florida so much is that those are states, Texas with a Republican governor, a very conservative one, who has talked a lot about how important wearing a mask is. This isn't really a right-left issue. It's not at all a right-left issue. It's really just, and it's not a freedom issue, right? The way we actually stay free and everything stays open is if you wear a mask. Any other questions?
It's been around for 2 weeks now. Is there evidence to show that it is working to slow down some spread in our area?
We set the order based upon evidence and information that we'd received from medical expertise all around the country. I think in talking to both of our medical professionals and others, we continue to hear that this is really one of our most important ways to stop the spread of COVID-19. It's not a coincidence. I know some folks may say that it's either evil Mayor Lucas or evil Governor Kelly or anyone else under the sun. It's not a mistake that 37 states have these types of requirements. It's not a mistake that most others have very strong recommendations relating thereto. And so we are continuing to see information that this is the best way to help stop the spread. Any other questions for you?
Yeah, one for Dr. Archer for a second. Doctor, you brought up the concern about schools. Looks like Missouri's going to go to every other day, classroom work, every other day, remote learning. Have you been talking with the local school districts here about this, or have you been talking to DESE? What's the level of your input with the schools as far as their approach?
So from state health department officials and locals, we've all been working with our various school districts really since back before the schools officially closed the first time. Lots of variables. I believe Kansas just came out with an 1,100-page plan. We're trying to boil that down to what are the top most critical pieces that need to be addressed, and then the other pieces, if there is time, and it'll depend on what's our background noise of the virus in the community on what we can do safely or not in schools. Most schools are realizing that there is a fair chance if they, as an example, don't immunize all of their students for influenza, that when influenza hits and we have COVID, we may end up with schools closed because of influenza, not because of COVID, or a combination of both. So yeah, we're having a lot of discussions on this. The virus, traditionally, we were not seeing the receptors in the nose of young kids, but we're now starting to see outbreaks in youth sports events and other youth camps across the state. We're starting to see more cases in under 10. So we're gonna have to watch this very carefully, and any plan usually has to be modified when it meets the enemy, and we'll probably have to be adjusting. Our goal, though, is to try to cohort to reduce the outbreak spread so that a whole school system doesn't have to shut down maybe that classroom. So we're going to be doing a lot of cohorting where those kids stay together when they go to recess, when they do various activities, so that it's contained if there's an outbreak within that group and it doesn't spill over into other folks. So those are some of the strategies. Working a lot with a couple of doctors at Children's Mercy Hospital as we're looking at and following the advice here. The American Academy of Pediatrics has recently put out information on this. Our larger health departments in the state of Missouri have also issued some guidance on this, and we in Kansas City are developing some strategies with our school districts.
And to follow up to that, what do you think about that plan of classrooms, say Monday, Wednesday, Friday, remote Tuesday, Thursday, the alternate plan, the alternate day plan?
So almost every system has to plan for the worst, which means that we actually have to shut down and everything has to go virtually. That's particularly challenging for grade school kids because they need that in classroom time with the teacher. So I do think that that alternate concept of you reduce the class size some, if everybody has to wear masks that are in the schools, it reduces some of the contamination issues, but as all of us know that have 4, 5, 6-year-olds, their verbal capacity to communicate, part of the teacher's ability to read the student is can they see the facial expressions. So we're looking at, in California and some other places have been looking at face shields possibly for smaller kids so that we can still read their reactions and teach effectively. Lots of experiments are going to go on. We haven't had this before. We're going to have to experiment and learn as we move forward. But I guarantee none of these things will be successful if we don't continue to make the progress we're making on getting adults to wear masks. And that is improving. We've got most businesses now realizing that they are the ones that control their business environment. OSHA holds them accountable for protecting their own employees. So these requirements are effective at helping protect the business's employees. We just need to be careful as we move forward that we're doing it in a polite way and understanding that some folks shouldn't be wearing masks, but we don't have to have 100%. If we can get up to 95%, we can get this outbreak under control.
One final question. Do you believe or do you think that that the bars and taverns in Kansas City are local hotspots and that they're the source of the spike?
There is good theoretical evidence that that may be the case. That's part of why anybody that's high risk, and if you're 50, you're higher risk than 40 for dying with this disease. If you're 60, you're higher risk than 50. You get up above 85 and you're extremely high risk. If you have other pre-existing conditions, you're at high risk. Those folks, you probably all heard the story about the epidemiologist and the ICU doctor and the public health director went out to a bar. Just kidding, we know better. I mean, it's not the right thing to do if we have high-risk folks that are being exposed. Now, if we get to the point where we can't respond in the medical system anymore and people's freedom of having a good doctor with a hospital bed is taken away from them because people aren't wearing masks or bars are causing outbreaks, then we'll have to cross that when we get to that point. And that's what's been happening in some other places.
Thank you all.